Hello, my name is Mary Neeson. I'm the Divisional Nurse for Surgery and Clinical Services. This short film will introduce you to the surgical departments within Causeway Hospital. These include outpatients, surgical ward, the elective and the emergency, theatres, day surgery, endoscopy and the intensive care unit. The staff within these units will show you around. They will tell you why Causeway is a great place to work and why the North Coast is a great place to live. We offer an excellent 6-month preceptorship and mentorship programme to all our new nurses. We encourage our staff to develop their nursing roles. These specialist practice posts include breast nursing, stoma, endoscopy, ENT, bowel screening, pre-assessment, oncology, anaesthetics, and many, many more specialties within the division. We also encourage our staff to undertake courses which will lead them to education roles and management roles. We would love all of you to come and work with us in the Northern Trust.
We are an outpatient department. We have 5 departments in total: outpatients 1, 2, 3 and 4, and dermatology unit. We provide outpatient appointments for patients, which could be review or new. As well as providing our general outpatient clinics, we also provide different services within our department. We have a day therapy unit. We provide treatment here for patients who have Crohn's disease and colitis, and this treatment can actually allow these patients to continue on with the normal life activities, such as continuing with a job. Previously they would have been hospitalised when their condition was exacerbated, but by having their biologic therapies here within an outpatient environment, they can return to their work, having their treatment, and they would get the treatment every 2 months. We also provide a vivisection service, which is nurse-led, and we have that here in Causeway Hospital, and it's extended out to our other colleagues in Antrim and the Mid-Ulster sites. This is where we treat patients with hemochromatosis, and we remove blood from their body to allow them to have their iron levels dropped, and therefore improving their general condition. We have a very vibrant and active dermatology department where we provide lots of services for patients with dermatological conditions, especially psoriasis and eczema. I have specialist nurses who work there, and they provide light therapy treatments on 3 days a week within the department. We also carry out a lot of surgical procedures, which people wouldn't expect to see in an outpatient department, but there's a lot of surgery going on, and the nurses take part and assist the consultants with Botox therapies, doing skin biopsies, punch biopsies, and providing a lot of treatment, which again can make our patients be able to stay at home and not require inpatient services. The outpatient departments offer great opportunities for both experienced and newly qualified nurses. There are so many learning opportunities within the outpatients department, being at the clinic and assisting the consultants, but also taking part in treatments and therapies that our patients require. We provide an all-day phlebotomy service within our department. Patients can come in for blood tests that are requested by their consultant or even by their GP, can also access some tests that we provide. There are treatment rooms where we would perform ECGs on patients. We also have dressings that we do for our surgical patients. There's ample opportunities for the nursing staff to avail of study. Because we're in a large department and we have computers in every area, there is no limit to the amount of e-learning that nurses can do, and we know in a ward environment that's quite difficult, but in an outpatient environment staff have access to computers easily, and they can avail of their break time and lunch time where they can do some e-learning. There's also great opportunity to attend study days within the trust, and the trust support for our nurses to go forward, especially for the revalidation, and they will gain lots of knowledge and lots of experience working within this department to lead towards the revalidation and their continued nurse development. Causeway Hospital is a fantastic place to work. I really love my job here. I wouldn't want to be anywhere else. I thoroughly enjoy the staff that I work with. I have a great team of nurses and nursing auxiliaries and healthcare assistants. Our support within the trust from our managers here on site and our consultant colleagues. It's just a marvellous place to work and friendly staff. It's really enjoyable. We also have the benefit of living in the beautiful Causeway Coast area, and we have lovely restaurants beautiful coastal walks around the whole area, and I would encourage anybody to come and live in this area. The houses are cheaper down around Coleraine than they are in other parts of the province, and would welcome you with open arms, and we'd ensure that you'd really enjoy your time working here.
My name is Chris McClarty. I'm one of the staff nurses in Causeway Hospital in the surgical unit. I'm not long qualified, I'm only qualified a year there passed in February. The surgical unit is divided into two different sections, so we have both the emergency section and the elective section. And the most cases that we would see in the emergency section then would be your cholecystitis, your diverticulitis and your appendicitis. And round then in the elective side, our most relevant cases for round there would be your hernia repairs, your larger bowel surgeries and also your different types of scopes. So this then enables the nurses and the staff working there to develop then their expertise in that area and gives them a wider range of knowledge then within such an acute setting. In the elective side of our unit, we are also partaking in the enhanced recovery programme, which enables them to reduce the infection and also promotes then a shorter length of stay for the patient, which then helps them have a greater experience. There is many a development opportunity within the ward, such as nurse specialist practitioners, stomach care nurses and also ward sisters. We also promote our own self-learning on the ward, so if you're very keen on a certain topic, then you're allowed to apply for a certain course. Personally speaking then, coming from uni onto the ward, when you feel that you don't know a lot, the team are very, very supportive and very encouraging of you then to learn. But also we work very, very well as a team and no question is ever silly. So you're always encouraged then to ask if you do not know. And we work great. The support is fantastic from the consultants to the healthcare assistants, and I can honestly say personally my experience on the short time has been fantastic. And for anyone that wants to come on to the surgical unit and have a look around Causeway Hospital, you're very, very welcome to do so.
Hi, my name is Glenda Wasson. I am one of 3 deputy sisters here in Causeway Theatres. Our unit is a wonderful unit to work in. I've been in theatres for 23 years. Within our theatres we specialise in urology, general surgery and gynae and obstetrics. We have a very busy unit. We do a lot of emergency work. It's very high paced. As I say, it is a wonderful place to work in. It's a great family to work in. In the mornings when we have our team huddle for each theatre and we discuss the list for the morning, at that stage then the anaesthetic nurse sends for our first patient. Our theatre porter goes to the ward, collects the patient, brings the patient to the theatre with a nurse from the ward and takes them straight into the anaesthetic room, where one of our anaesthetic nurses greets the patient and goes through their admission. When everything has been checked and confirmed with the patient and the nurse and the anaesthetist, then the patient is taken into our theatres to have their procedure. After their procedure is complete, they are brought out to our 6-bedded recovery unit and they are kept here until they are fully awake, pain-free, comfortable and happy to return to the ward. There is vast learning in theatres. There's not a day goes past that you don't learn something new. But there are lots of opportunities. When you would come to theatres at the start, you would go through a competency framework. We do have an induction pack for each and every individual, be you a student nurse, be you a newly trained nurse or a nurse coming from another area. You will be given a mentor or a preceptor depending on your qualification or at what stage you're at in your nursing career. Once you have met all your competencies within the area, and that takes in anaesthetics, scrubbing, recovery and also floor duties or circulating as it would be known as. Once you've completed all your competencies within each of those areas, then you are fully fledged to work in all areas in theatre. And that again, once you have all those competencies, then you can actually work in any area. Well, I personally love theatres. I've always loved theatres. It's different to anywhere else that you'll work in the hospital. We believe that as theatre nurses. We have a lovely family here. everybody looks after everybody else. We have a fantastic rapport with our multidisciplinary team, our consultants from all specialties. We have a great working relationship with them all. We have many social evenings. We cover each other to be able to allow each other to go. It's just such a great place to be. There's so much to learn, there's so much to see. Every day is a different day, and we would encourage as many people to come to theatres and see it. It can be daunting at the start, it definitely can be, but I think once a theatre nurse, always a theatre nurse. So if you get the opportunity to come to theatres, make the most of it. You will enjoy it, and it's great fun.
Day procedure unit in Causeway Hospital is a combined unit. Being combined, it has 2 theatres for day surgery and a theatre for endoscopy. Our specialities are within the day procedure unit. We have gynae, we have surgical, we have ENT, we also have a pain clinic, and we deal with dental surgeries as well. And endoscopy, we have urology, bronchoscopies and ERCPs. We are a nurse-led discharge area, and meaning with that is we meet the patient on admission and we follow them right through the process into theatre, and from theatre then we follow them back out into first stage recovery. I'm actually discharged in form recovery ourselves. If you come to work in this unit, we are a highly motivated unit with highly trained staff that like to work well within a team. You will get training, and if you go into theatre with scrubbing for procedures, for anaesthetic training and floor management, and you also get trained up in endoscopy and for first stage and in the discharge area. We're an extremely busy unit. We do deal with a high turnover of patients on a daily basis. If you do decide you want to come and work within the day procedure unit, you will be working with a highly trained and motivated team. We will aim at assisting you and supporting you through your journey, making the transition into day procedure, and we do look forward to seeing you in the day procedure unit in the future.
Hi, my name is Adeline Mina. I'm a Deputy Clinical Sister here at Causeway Intensive Care. We have 4 beds in this unit, 2 are intensive care and 2 high dependency beds. Every patient is different, no 2 days are the same. We work very much as a multidisciplinary team. Our main aim at the end of the day is high quality patient care and a positive experience for every patient and their family. The Causeway Coast is a great place to work. The facilities in the area, I would say the schools are very good. I've been here 10 years. I love coming to work, I never dread it. I enjoy every day. I wouldn't work anywhere else. Whether you're newly qualified with a few months experience or an experienced nurse, you'll be supported in everything that you do here. You're encouraged to have your own interest, develop yourself, do further study, and you'll be supported by your manager all the way. I'm passionate about what I do. I really enjoy what I do. That one-to-one experience that you get with patients. There's the atmosphere here. Everybody's very supportive. It's just a lovely place to work. I can't say anything more than that.
Well, I am the General Manager of Surgery within the Northern Trust. My name is Linda Millar. I actually am based here in Causeway, but I've also lived here and brought my family up within this vicinity. So I've had the experience of excellent schools, after school clubs, and indeed summer schemes for the family as they were growing up. So that involved water sports, it involved attending for tennis, for badminton, etc. And it is a fantastic place to bring your family, to allow them to avail of all of those opportunities. Causeway is exceptionally a very friendly hospital, and you will get to know people very quickly who will look after you and make sure that you're safe within your workplace. So I would welcome you all to come to Causeway, experience the Causeway experience, because it is tremendous.